Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Dr. Nyalakonda, a ophthalmologist here at Cullman. Thanks so much for joining me today.
Of course. Thank you for having me.
Yeah. So before we kind of dive into the topic of cataracts, give us a little bit of background about your journey to become an ophthalmologist and, journey to get here to Cullman.
So I was raised in Cupertino, California, eventually made my way down to the South when I went to college at UAB. After I finished college, I went to medical school up in Michigan. And during medical school is when I really decided I wanted to do ophthalmology. I loved that you can do clinic and you can do surgery and you can really give patients a huge gift, and that is vision. And after medical school, I finished residency at UT Houston and I made my way back. My husband and his family are from Alabama, and so that's how I kind of ended up here in Cullman.
So it's incredible just to see kind of that journey as far as, from California to Alabama to Michigan to like all over the place, it seems like, and then now landing back here in Cullman. For today's topic, we're talking about cataracts. For those that are listening or watching, what are cataracts and how do they kind of impact the vision of a patient?
Yeah. So cataracts are something that everyone will develop once they reach a certain age. We're all born with something in our eyes, and that's called a lens. Our lens is what helps focus light onto the back of our eye into our retina. That lens can get cloudy over time, and that's what becomes a cataract. People will discuss symptoms of cataracts, and they'll say that they're blurry, their vision is getting hazy. They have a lot of glare, especially when they drive at night with bright lights. These are very common symptoms of cataracts. A lot of my patients will say that they feel like they're looking through a dirty windshield. So pretty much cataracts, everyone, after the age of 50 will have cataracts, but that doesn't quite mean that, you need cataract surgery. Right.
Yeah.
So cataracts can take a long time, from a few years to 30 years to never to you needing surgery. And so that decision really depends on the patient and the doctor and kind of the decision that they come up at the end of the exam.
Yeah, and so it's something that happens for most people after they turn 50. But is it purely? Do you only see people after 50, or do you see people coming in their 30s and 40s that get cataracts earlier in life?
Yeah, that's a good question. So you can get cataracts definitely earlier. There's a lot of different diseases that can increase your risk of getting cataracts from a younger age. You can even actually be born with cataracts, and that's called congenital cataracts. But I see patients in their 20s, 30s, all the way up to their 80s and their 90s, and even past that. And that's because if you have diabetes, if you take steroids, oral steroids, and if you have other autoimmune diseases, you are at an increased risk of having cataracts at an earlier age. And so I do cataract surgeries on patients younger than 50, definitely, but also older.
Yeah. And so as the patient comes in with some of these symptoms, the blurred vision, they're just not seeing well at night, how do you determine if surgery is necessary or if there's other treatments that could solve the problems they're having? And maybe what are some of those other treatments?
Yeah, it's a really good question. So cataracts, like we were talking about, everyone has cataracts. When is the right time for surgery? So first we take a look at the vision with and without glasses. We see, can we give you a little bit of glasses prescription and see if that kind of alleviates your complaints or your symptoms of blurry vision? And if it does, a lot of the times we'll try glasses first. Sometimes, when patients' cataracts are large enough or big enough and you're trying different kinds of glasses, nothing is really working, and you're kind of giving yourself a clue that, hey, maybe it's time for them to get surgery. Maybe it's time for them to get cataracts. So yeah, the main thing is just to look at the vision and then taking a look inside their eye, talking to the patient about what they like to do. Let's say all they like to do is knit or read or focus a lot of the times close at arm's length, and they can't do that anymore. Maybe they need reading glasses, but also maybe they need surgery to help them see and do what they want to do.
Yeah. And so talk a little bit about that surgery procedure. So say you get the patient comes in, they have the symptoms, you determine that, hey, surgery is best fit. What does that look like for the post surgery for the patient getting ready, or pre-surgery for the patient getting ready for the surgery? And then what does the procedure look like as a whole? And then what is sort of the the moment that they will have clear vision again?
Yeah. So cataract surgery is one of the most common surgeries done in the world. It is a day surgery here. So what happens is patients will come to the hospital in the morning and they'll leave a few hours after. Wow. The whole surgery itself takes around 10 to 15 minutes, sometimes shorter, sometimes longer, depending on, the different complexities of it. And they go home that same day, but they are seen in clinic one day after surgery and typically 1 week after surgery. And then sometimes even 1 month after surgery.
Okay.
And how cataract surgery works is I make an incision in the eye, I remove the cataract using a special ultrasound tool that I have, and I put in a lens implant in that same spot. Now, there are different risks associated with this procedure. There's always a risk of infection. There's always a risk of inflammation with any surgery. And then something specific to cataract surgery is that cataract actually sits in kind of a bag. And so when you're taking out that cataract, sometimes that back of that bag can get damaged, and that can sometimes necessitate a patient to get more than one surgery to totally remove the cataract and get a lens implant. Again, these are pretty rare. They're around like 3% or less, wow. But they can still happen. Typically, depending on how big the cataract was, it can take more or less energy to remove the cataract. And so if they had a huge cataract and it took a lot of ultrasound energy to remove that cataract, their vision 1 day after surgery is going to be pretty blurry. Versus somebody who might have not had such a big cataract, they might not have needed as much energy to remove the cataract and so may have clearer vision at like 1 day after surgery. Wow. So it really depends on the patient, but I will say maybe around days like 4 to 5 is really when things clear up a lot, when the colors are brighter, when you can, start to notice a big difference from pre-op and post-op.
Yeah. And so I guess is it really just the timing at which the patient comes in with symptoms kind of often determines the severity of the cataract?
Yeah.
And so if they're able to catch it earlier on, they're able to then maybe have a quicker clear vision, while if they wait to put it off, they're like, I don't want to do this, I don't want to do this, I don't want to do this, and you're like, you should have came in 6 months ago, and now it's becoming more of an issue. It takes more energy to get it out.
Yes, so that happens a lot, and maybe not like a few months. I'd say like maybe there was a patient that we were seeing and then something happened, they got lost to follow up, and then they come back and see us 5 years later. And then now their cataracts have grown significantly. That means, it's a little bit more of a complex procedure. It's going to be a little bit, of a delayed recovery. But you should still be getting to that end goal of, clear vision.
And so with the surgery lasting, 15 minutes or so, on days that you're doing cataract surgeries, how many are you typically doing in that day? And kind of what does your schedule kind of look like when you're, obviously there's days that you're just meeting with patients, you're reviewing results, seeing if they're best fit. But the days you're doing surgery, what does that look like for you as far as how many cataract surgeries are you typically doing?
Yeah. So I do anywhere from like 7 to 10 cataracts and per day. And so that is, going up depending on how many patients I'm seeing and, how many patients need cataract surgery. So 7 to 10 per day, but I expect it to, continue to increase because there are a lot of patients here with cataracts that need cataract surgery. The other days I am in clinic, seeing cataract patients with cataracts, but also doing a lot of laser procedures in clinic, doing a lot of like eyelid lesion removals, seeing other pathologies like glaucoma, macular degeneration, things like that.
Interesting. That's awesome. So I would assume, the advancements in technology to help do the surgeries of cataracts has continued to increase and making it easier for you to actually do the surgery. What does sort of the future look like? And maybe some of the what is the horizon as far as what the surgery could be one day and like the ease at which that surgery could happen to get clearer vision for the patient?
So cataract surgery, the way that we do our surgery is pretty new. I mean, this has really come along in the last like 50 years or so. But everything is done like with our hands. So like I make the cut with my hand. All the parts are done with me moving my fingers and my wrists. The things that are kind of newer, the different ultrasound machines that we have, the different microscopes that we have, and different tools that we use in the eye. But, most cataract surgeons are doing everything manually.
Yeah. And so I would assume that there is a possibility that cataracts do come back, or is that a low chance once you remove them? And could patients potentially come in their 40s to get cataract surgery, come in their 80s to get cataract surgery?
Yeah, so cataract surgery is a one-time deal. So once you have cataract surgery, you never have to have it again. They never come back. But there is something that patients notice after cataract surgery that some people even call like a second cataract. However, it's not really a second cataract. So remember how we were saying that implant goes in a bag, right? Sometimes that back of that bag can get kind of cloudy and hazy a few months after cataract surgery to a few years after cataract surgery. And when that happens, if a patient comes and sees me, there's a laser that we actually do in clinic. It's called a YAG laser. It takes about 2 to 3 minutes. And pretty much all I do is kind of clean up that back of that bag. And, within a few hours or the next morning, patient is a lot happier. Again, colors seem brighter, things are kind of back to how they were. And this is called a posterior capsular opacification, or a PCO. And it is very common. It's like it's the number one complication after cataract surgery. And it just happens because sometimes during cataract surgery, you're not totally getting every single cell out. And so over time, those cells will proliferate and lead to this thing called a PCO.
And so for those that maybe are listening and have been newly diagnosed with cataracts, what advice would you give them as they're going through the process of meeting with a doctor, getting scheduled maybe for the procedure, and then all the steps involved?
So I would say it's very important to kind of, make sure you go to your appointments, whether that is you and your doctor deciding, hey, we can wait, you really don't need cataract surgery right now, or hey, we should actually probably get this taken care of. Just kind of like making sure that your follow-ups are, routine. Just making sure that you're seen at least once a year by an eye provider is a great idea, either an optometrist or an ophthalmologist. When you get close to surgery, typically that's when your optometrist or your other eye care provider will refer you to an ophthalmologist. And that's when we will, check your eyes, see everything that's going on, and then finally decide if you need cataract surgery or not. Just keep in mind that the recovery is pretty short, in that within 5 to 7 days, you're pretty much back to normal. In those few days, you're still able to walk around and pretty much live your normal life, except for like not lifting heavy things or really straining yourself, and just taking it easy for a little bit. But I would say the recovery is, quicker compared to other surgeries.
Yeah, for sure. Well, I appreciate you being here today. I think it's interesting just to see that process, kind of what your days look like, the advice you have for people, because it's something that everyone's going to get. And so it's something that no matter if you're listening to this at 20 or listening to this at 60, there's a chance that you're going to get it, and you probably will. We'll be sure to have everything in the episode notes, links to anything that we've talked about, but I appreciate you being here today.
Of course. Thank you for having me.